Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Okay, and while she's doing that, Sarah's written in and said, "Hi, Dr. Doreen. I'm living in the UAE and a mother of 2-year-old identical twins. We first saw signs at 13 months old. Given that we don't have any financial support through insurance, we did a lot of therapy ourselves and later hired a registered behavior technician. They're currently doing ABA, I'm trying to hide that. Sorry. They're currently doing ABA 5 hours per week, each of them. She goes on to say they've progressed really well. They can mand, tact, answer simple questions, really good with academics, numbers, alphabets, reading 3-letter words. They are still behind in social and play skills, but she wants to know, is it possible? They're seeing great progress in their ability to learn so quickly. I sometimes wonder if they're just developmentally delayed, or is this in fact autism? What is the possibility that they are just delayed?
I mean, of course, there's a possibility that they are just developmentally or intellectually delayed for some reason. And there's a difference. There are specific symptoms that need to be present in order for a child to be diagnosed with autism. And those are not the same symptoms as any kind of just general developmental delay or even intellectual delay. So the specific symptoms of autism there's a series of symptoms within the first category. There's 2 areas with autism. One is social communication, and the second one is the presence of what we call repetitive, stereotypical repetitive behaviors. So the first portion, the things that are kind of in that social communication area, sounds like your child has some of those things, your children. And we're talking about delays in language, right? So the children can communicate the way they should at their age. They don't have attachments to other children or to people the way that they should. They don't have nonverbal communication. Nonverbal communication is stuff like looking at eye contact or responding when they hear their name, or joint attention tasks like being able to look at you and then track your eye contact, those types of things. So those things are missing. And generally when you have a delay in language, it affects social skills. So there's a resulting delay in social behavior as a whole. So it's kind of like the child doesn't learn how to play appropriately with others, doesn't learn how to play appropriately with toys, just kind of starts to develop their own a little bit like isolated world. On the other side, which, by the way, both areas are required for a diagnosis of autism. So in the area of kind of the stereotypical repetitive behaviors, we're looking at, first of all, possible sensory sensitivities, which is very important. So kids who are, they are very sensitive to, let's say, sound or light, or they look at light in a certain way, or they play with sound, or very, like they're dysregulated with textures. So they're constantly touching things or playing with them and that sort of thing. Or another area could be just repetitive behaviors like opening and closing the door, turning the lights on and off. And then there's stereotypical behaviors like lining up toys or objects in a kind of a fashion that doesn't make sense to anyone. Being very upset with transitions or changes in their environment. So both of these areas have to be present if you're looking for a diagnosis of autism. And certainly, doing ABA, which is what you're doing, and that's terrific, works with kids with autism, but it also works with kids with other developmental disabilities for sure. It works with kids with chromosomal issues like Down syndrome even. ABA is just a way to teach. So yeah, I mean, and often I tell people, especially in a country where you don't have health insurance coverage for autism, it doesn't matter what the diagnosis is. It really doesn't. Here, I always tell people in the US, the only reason you want to get a diagnosis is so you have coverage, because the bottom line is we don't care about the diagnosis. What's important is to break down the behaviors and work on reducing behaviors that are not adaptive, that are challenging, like we were just talking about, like aggression, and increase skills that are deficient, right? So we want to make sure we're increasing those areas like you are, in language and social and so on.
But can we also acknowledge that because there are some kiddos that are showing signs of autism so young now, we've always talked about early intervention, Dr. Granpeesheh, but there are some kids now that are getting diagnosed so early that I always think about the phrase that you used to say to parents about, your child is behind and we're going to get him caught up and we're never going to let him fall behind again. Very famously quoted in Christina Adams' book, A Real Boy. And that's the kind of thing that gets parents so excited. We're going to get your child caught up and never let them fall behind. But, you and other people have now been able to take some of these kiddos when you catch them at such an early age and get them caught up to the point where, am I wrong in saying that some kiddos who were on a track where they would have been diagnosed with autism never actually get an autism diagnosis because you catch them up?
That's very true. And it all has to do with kind of the age of the child and the areas that the amount of work the child needs, right? So the younger the child, the less effect of autism and the more hours we have is kind of where, we get the most success. I have had children where the parents, one of our dear friends, Ilana, is a good example of this. When a parent has another child with autism and they know the symptoms so well, they recognize the signs so well, the parent will often be able to see some delays or issues arising when the child is like one and a half. And when they're that young and we can get in and work really intensively with the child very early on, sometimes the child doesn't even, before the child gets to be like 4, the child's diagnosis is gone because they never developed enough of those symptoms that are required for a diagnosis. So you're absolutely right, Shannon. It does happen. And even if there is a diagnosis, I mean, I just made a diagnosis on Monday with a child where, I just want to get in there and get going as fast as possible with them because the sooner you engage, the sooner you do intervention, the more you're teaching. It's just logic, right? I mean, any skill, the more time you spend on it, the more the child has a chance of getting better at it.
Just Macy wrote in and said, I want to meet you and Dr. Doreen one day. Let's make it happen. I think as we get back out into the world, we're going to be more places where we can meet you. I look forward to meeting you as well. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.